Emanuele Capobianco is the head of health and care at the International Federation of Red Cross and Red Crescent Societies, and he joins us now. Well, thank you very much for joining us here on TRT World, Emanuele. So, as the coronavirus is spreading to more countries, what role is the Red Cross and Red Crescent Societies playing in preparations and precautions efforts?
The Red Cross and Red Crescent Societies have been active all over the world in 190 plus countries to prepare for this epidemic and to respond where the epidemic is already raging. We are working on two main fronts. One front is the front of the information. There is an epidemic of the virus and an epidemic of fear that needs to be managed. So the Red Cross is providing valuable information, fighting the fake news, and also pushing a lot the issue of solidarity in fighting stigma, which is one of the problems that we are seeing emerging with this epidemic as with other epidemics. The other front for the Red Cross action is really on the ground, providing support to the people who are suffering, helping in screening, helping in treating patients in hospitals, providing psychological support to people who need that.
And Emanuele, as you are gathering that information, looking at the figures then, how alarmed should we be?
So we are looking at China, of course, the epicenter of this outbreak, where numbers have started declining over the past few days in terms of new cases. Mortality is still high, but that is a positive signal. If you look at Singapore, also there, the outbreak seems to be being contained. And so these are positive signals. But if we look at other countries, South Korea, Italy, and Iran, what we are getting are distressing information of numbers climbing. Over the past week, we have reached almost 1,000 cases in South Korea. Italy has locked down more than 50,000 people in the northern part of the country with an outbreak that is moving quite rapidly. In Iran, we have only 60 cases being confirmed, but there is quite a high number of deaths that makes us believe that there are many more cases, and we are also seeing a lot of exported cases from Iran in other countries. The Middle East had a number of countries now being infected: Oman, Iraq, Iran, Bahrain, and others. So it is a situation of concern that all the public health international organizations like the Red Cross are monitoring very, very closely.
Now, every country doesn't have the same resources or hospitals to contain this virus. So, Emanuele, in terms of help, which countries do need it most when it comes to containing the virus?
So there is, for me, an important focus on preparing those countries with the weakest health systems so that when and if the epidemic arrives, the response can be stronger. So that's one part, and I'm looking particularly at Africa as a country that has the highest vulnerability. Then we need to strengthen the capacity of those countries that are right now facing the epidemic, realizing that there is no single country in the world that has the full capacity to respond satisfactorily to an epidemic if this goes very, very big. So we are really trying to support those countries that are trying to contain the virus, and also even they're preparing for a possible further expansion of the outbreak.
Well, we have to wrap it up here, but thank you very much, Emanuele Capobianco, for that insight and information.